What it means now that the coronavirus is a pandemic. It's now official, with the novel coronavirus in over 100 countries by mid-March. The World Health Organization declared the outbreak a pandemic. Though the label might seem semantic, the step could help spark more emergency action plans around the globe, bringing with it more disruptions to daily life. Still, questions linger about why the WHO deferred the call for so long, and what prompted the change. What's the definition of a pandemic? The technical criteria are when a new infection, against which most people do not have immunity, mushrooms across continents. That's a bigger threat than an epidemic, which refers to a more constrained spread to a specific country or area. But the dividing line can be fuzzy. What were they looking at here? In general, the WHO will examine the geographical reach of cases, along with the deadliness of the disease and the effectiveness of containment efforts before declaring a pandemic. In this case, the virus, which causes the pneumonia-like COVID-19 illness, has spread well beyond its original epicenter in the Chinese city of Wuhan. There are aspects of the virus's spread and transmission that are still not clear, as well as early indicators of slowed or stopped transmission in some places, including China, Singapore, Nepal, and Vietnam. A declaration is often triggered after efforts to contain the outbreak in specific regions or countries fail. The goal then switches from containment to mitigation, trying to ease the pain. What does a pandemic designation mean on the ground? It could spur more countries to roll out higher-level, emergency-grade response plans at local and state levels. One major tool is what's known as social distancing, finding ways to limit personal interactions where the virus could transmit, such as closing schools or canceling public events. Shortly after the declaration, U.S. President Donald Trump suspended all travel from continental Europe to the U.S. for 30 days. How does this compare with other recent outbreaks? The new coronavirus is from the same family as the one that causes severe acute respiratory syndrome (SARS). Its mortality rate appears to be much lower, but its highly contagious nature has led to more deaths in 2 months than all those recorded in the 9-month SARS epidemic. All countries can still change the course of this pandemic. Those with a handful of cases can prevent those cases from becoming clusters and those clusters becoming community transmission.